Hello, my name is Kim from the Holler Heilpraktikerschule. Today we are excited to present to you a video showcasing the incredible benefits of Dawn therapy for treating the sacroiliac joint. Dawn therapy has proven to be a remarkably gentle yet highly effective method for releasing blockages in the spine and joints. As the central point of our body, the sacroiliac joint is both vulnerable and crucial. However, with Dawn therapy, treating it becomes a breeze. In just a moment, Olaf will demonstrate how this technique works. Keep in mind that this is solely provided as useful information. If you wish to delve deeper into the subject, we encourage you to subscribe to our channel, where you can discover seminar dates and a wealth of additional information. Enjoy the video and good luck with treating the sacroiliac joint.
We are now going to treat the sacroiliac joint first. I always start with this in thorn therapy. The SI joint is the articular connection between the sacrum and the pelvis, and the SIJ joint is relatively easy to move. You can move the pelvis forwards or backwards, for example when running, walking, and so on. The challenge with the SI joint in spinal therapy is that it cannot be effectively treated without the use of aids. Achieving consistent results is a constant struggle. Unfortunately, this means we have to rely on aids like sliders in order to properly address the issue and provide effective spinal therapy. If I need to remedy a blocked SI joint on the right side, I must utilize the slider tool in this specific area. It is crucial that the slider effectively targets the spinous processes of the sacrum and not the SI joint, as the latter can cause harm. The application of the slider is focused here. Following traditional spinal therapy, the patient then positions themselves on the blocked side and performs swings with the leg on the unblocked side. Simultaneously, I walk around the patient, using my other hand to gently pull the pelvis away in order to open up the SI joint in this region. As the patient swings, I position the slider accordingly. Once I complete a rotation around the patient, I pull them towards me with the slider, thus simultaneously opening the SI joint on the opposite side. This action provides release. The exceptional aspect of this technique is that it consistently produces positive results. There is no danger associated with this method, and I can employ it to treat herniated discs. Regardless of the patient's condition, this approach remains effective. That is the unique attribute of this grip. In terms of releasing the SI joint, the actual method utilized is not particularly significant, although it is essential that it is eventually released. However, the specific feature of this grip is its remarkable reliability, even surpassing that of chiropractic techniques. In addition, the SI joint holds an inherent characteristic that sets it apart and showcases its significance. It can contribute to almost all lower back pain, or at least be involved in its origin. Therefore, when a patient experiences lower back pain, I prioritize treating the SI joint initially, as it often yields significant improvement. This approach addresses a common type of SI joint pain that occurs when a patient bends forward to brush their teeth and struggles to return to an upright position. Of course, it is not only the SI joint that plays a significant role. Other obstructions and imbalances also contribute to the issue. Additionally, I must address the condition of the lumbar spine. In thorn therapy, it is customary to treat the rest of the spine along with the targeted area. Nevertheless, the advantage lies in the ability to directly address the source of pain, which is why I always prioritize the SI joint. This joint is of utmost importance, particularly in terms of body balance. Major leg length discrepancies are often caused by blockages in the SI joint. The explanation is rather straightforward. When the pelvis tilts forward, the entire hip joint slightly moves downwards, consequently elongating the leg. On the other hand, if the SI joint tilts backwards, the whole hip joint moves upwards a little, and the leg becomes relatively shorter. And then we often have a torsion, a twisting of the pelvis. This means that one is tilted forwards and the other is tilted backwards. And so I can easily have a 1.5 centimeter difference in leg length that is only caused by the SI joints. Before we treat the SI joint, we also need to know which side is blocked. This is where we use the preliminary test, which is simply the most practical in Dawn therapy because it allows us to treat everything in one flow. To do this, I look for the posterior upper iliac spines. I will grip the thumbs on that area and ask the patient to lean forward. Now let's observe if either side makes a move. Alright, let's go back once more. We need to repeat that once again now. I didn't observe anything in that moment. A helpful tip is to simply close your eyes. Now repeat the action, leaning forward once more. Yes, there is a slight movement on the right side. This movement is visible to the naked eye. You can observe it here. The right side accompanies you when you move. This indicates that the right side is obstructed or blocked. Now I will retrieve my slider tool. I take one step forward and place the board between my feet. As already mentioned, the right side is blocked. This implies that she is standing on the board with her right leg. The other side is on the right. Swing with the left leg. The slider is placed here, as I have just shown on the model, on the spinous processes of the sacrum. I walk around the patient, grab the pelvis here, pull the slider towards me, and at the same time pull the pelvis apart. I hold this for 2 or 3 seconds. Then I take a short break. Pause for 1 or 2 seconds. Then hold again for 1 or 2 seconds. It's like a TheraBand. You build up the pressure slowly and again. 3 repetitions each time. Sometimes it doesn't work on the initial attempt, so I find myself having to go back again. Unlike in chiropractic, I can't hear any cracks or sounds to know if it's working, making it necessary for me to test. Through the years, I've developed the ability to sense if it's loosening. However, there are moments where you might not even notice it. That's precisely why I must test it at this moment. In that case, it's good now. Okay, you're coming back. In that case, it's good now. But there are 2 other possibilities. I'm simulating them now. It looks different in real life. Follow me forward again. The possibility would be that it runs again. Okay, stop, back again. And the other possibility would be that it moves along on the other side. Then it would look like this. Then I would treat the other side again. But in this case, it was like this. The right side was blocked. I treated it and then it was straight. Okay. Now follow me forward again.